Hello, and today I'll be speaking to you about youth engagement in healthcare and how personal health goal setting can improve care engagement. Our targets are to identify 95% of individuals who are living with or at risk of HIV and get those that are living with HIV onto medications in order to achieve viral suppression. In order to get there, we need to accomplish multiple steps. We need to know one's status, engage individuals into care, increase adherence, and be overall engaged in health. Goals can accomplish this because they can encourage personal agency. Goals actually help to engage in physical activity as well as in risk reduction and also retention in other healthcare settings, including mental health. And so the PUSH study, providing unique support for health, is a goal-based intervention for Black and Latinx sexual minority males and transgender women who are living with HIV or at risk for HIV. It occurs across 4 US cities as shown here and focuses on life skills, motivational interviewing, and reflective listening, as well as goal setting. In this study, we sought to explore what common goals described by participants in the PUSH study intervention arm. And we really wanted to see whether or not those goals were able to be linked to care engagement. We looked at coaches' notes to identify the goals that were described and categorized them into groups. And then we used the logistic regression to see whether or not goals were associated with a health goal, HIV engagement, or PrEP care. 464 youth completed a behavioral health survey. Of those, 180 were enrolled into a randomized control intervention, including 36 youth living with HIV. Of those, not virally suppressed, and 141 at risk for HIV. The mean age was 21. 14% were Latinx youth, most identified as gay or bisexual. There were 10% transgender or gender diverse youth. A quarter of youth described not being able to have a regular place to stay in the last year, and there was very high substance use. So what were the goals? There were overall 84 goals identified in the sample. 20% occurred around finding a job, and that was the most common goal among the youth. 16% described a medical or health goal. 14% described a mental health goal, and almost 12% described an educational goal. What we found was that having seen a medical provider in the last year was associated with a 6.5 greater odds of having a physical or medical goal. In the unadjusted model, also having a substance use goal as well an educational goal was associated with having a physical health goal. So this work suggests that youth are actually focused on having goals, and they're interested in having goals. Their goals really center around finding a job, but also around improved physical and medical health, mental health, and educational goals. Having seen a provider recently was associated with having a health goal, and also substance use and educational goals also tied closely to having a health goal. There's some limitations of this study that should be noted. It was conducted as part of a randomized controlled trial intervention and may not translate to all practices. It's also a US-based intervention, so it may not generalize to other communities or other settings. And as we know, not all study participants reflect those that may not engage in study participation. However, the implications of this work suggest that in order to identify youth who are at risk for HIV or living with HIV, We have to focus on engaging the provider and engaging in care. And motivating youth can actually be one critical key step in reaching that goal and potentially ending the HIV epidemic. Thank you. I want to support and acknowledge my funding agency, all the youth that contributed to this work, as well as the student investigators that assisted with this work, and the PUSH study team and collaborating sites. Thank you.